The whole reason that I got involved is I had breast implants put in just for augmentation reasons. I didn't have cancer. And I was just told that the only incident that could happen is possible rupture and then surgical risk. That's it, nothing else. So I went through, had them placed, had some symptoms immediately, but didn't relate them to my implants because, I just didn't relate them. And then after about 4 years of having my implants, I was really, really sick. And for about 6 years, I chased my tail, going to doctor to doctor to doctor until I was bedridden. Then that someone suggested, hey, it could be your implants. And even then, because every doctor says, no, they're safe, no, that it can't be your implants. So it took me another year before I really realized that it was my implants. And my defining moment was when I was bedridden on my couch, just feeling like I was dying, like, most women feel when they're in that position. I said, if it is my implants, I will not stay quiet. I will, because I didn't have that informed consent. It was just brushed off. It's like, getting your nails done or getting your hair done. Having implants placed is so simplified, and it's not a simple procedure. It's pretty invasive. That is the reason when Robin and I met at the FDA first hearing and we were roommates, that's kind of when we got together and started brainstorming and discussing how we want to make changes.
I think Terry and I had an experience when we were just in Atlanta at the ASPS, which is the American Society of Plastic Surgery. We spoke to a surgeon there, and I'll never forget his words because he thought it was so interesting that he said, the top 3 things that I think patients should know about surgery are not the top 3 things that patients want to know.
Patients.
And it was like this light bulb moment. And Terry and I were like, that's exactly what we've been trying to get across. So the patient checklist that we developed, this is made for patients. It's made for patients to read and understand. It needs to be in terms that they know, that they're comfortable with, that they're used to hearing. So if you're throwing a bunch of medical terminology at patients, it tends to go over their head and they're not going to absorb that. It's not going to stick with them. So patients know the words black box warning. It's on cigarettes, it's on Botox, it's on a lot of things, and people know that as a danger label. So we agreed after about an hour of discussion that that's the terminology that needed to be used. But in the other states that we're working with, we just had local women write letters and reach out and say, this is who I am, this is what happened to me, this is what my doctors didn't tell me, and we really think it's important to follow Arizona, and I'd like to pass a similar law here in my state. And we've had floods of letters come in, pouring into the senators' offices. And again, once they hear our stories and our journey, it's almost impossible to say no, because who doesn't want patients to have more information, right? It needs to be an educated and an informed decision. Yeah, Terry and I are very much the same in that we are not going to stop until everybody knows this.